How do we detect breast cancer? Is self-breast exam ba useful? Or is clinical breast exam better? Teka, ano ba munang pinagkaiba ng dalawa? Well, ang self-breast exam is an examination of your own breast, whereas clinical breast exam is one examination made by the doctor. Sa study na ito shown on the slide, wala silang nakitang difference between the two, which is self-breast exam and clinical breast exam. And if you check on the current guidelines on the use of both CBE and BSE, it's mixed or controversial. The American Cancer Society no longer recommends both for women with an average risk for breast cancer because research has not associated with them any clear benefits in settings where mammography screening is available and awareness is high. However, you have to remember we are here in the Philippines and mammography is not high and awareness is low. So baka pwede. The United States Preventive Services Task Force, this is an independent voluntary group of experts no, in the US, which is more focused on disease prevention. They too also discourage the use of breast self-exam and that there is not enough evidence to evaluate the clinical breast exams. On the other hand of the spectrum, the NCCN, no, or the National Comprehensive Cancer Network, recommends CBE, or clinical breast exam, every 1 to 3 years, beginning at the age of 25 to 39 years of age. And then, once you hit 40, annually na. If you base that on literature, it seems to suggest that clinical breast exams are better than self-breast exam. Whereas in other literature such as this, there seems to be no significant difference. Bottom line, I feel, whether with benefit or not benefit, which is better, either self-breast or clinical breast, point ko, by the time na makapa mo yung bukol, may kalakihan na siya. So these two are not the best tools to detect breast cancer. Dapat mas maaga pa lang better. Another tool to detect breast cancer is mammography or the use of X-ray sa suso, sa breast. There are actually two types of mammography according to use. Isang screening mammography at isang diagnostic mammography. Sa screening mammography, ang target mo are the asymptomatic patients. Kadalasan, ito yung mga nakikita mo during the annual physical examination na nagpapamammography. Ang difference nito between screening and diagnostic mammography, yung diagnostic naman, ito yung pumupunta sa'yo kapag meron ng palpable na bukol. Ang value ng screening mammography is that if you do this, you are ahead 2 years before the lump is felt. Ang ibig sabihin, nakikita sa screening mammography kung ikaw ay may bukol 2 years ahead bago mo pa ito makapa. So better. Screening mammography starts at the age of 40. If normal, most suggest it will be every 2 years na thereafter. Although recommendation states that dapat daw taon-taon, but you have to remember about radiation. X-ray din yan. And accumulated radiation in the body may cause cancer, but several years later pa. Shown to you is an example of a mammographic image. Sa dalawang picture na yan, you can see the tumor or bukol as pointed by the arrow. Based on the appearance of the tumor, this is considered a benign tumor. Benign meaning hindi cancer. So, ano ba ang itsura ba ng cancer on mammogram? Mas malaki ba o mas maliit? Shown are the distinguishing features base sa appearance ng bukol on mammography between a benign and a malignant tumor. Sa ospital, we call this radiologic appearance. Radiologic kasi X-ray or X-ray appearance of the bukol. The difference between the two, mapa benign or malignant, can be summarized into 3 points or the acronym MIC or MIC. MIC is M for margin, I for intensity, and C for calcification. Ang margin ng benign tumor are said to be round or oval, circumscribed yung sinasabing clearly demarcated yung margin. Malignant, however, are the opposite. They are irregular, indistinct, or speculated margin. Speculated meaning patusok or parang may spikes or pointed. Intensity or opacity of benign tumor appears low. Low meaning parang see-through at hindi ito solid white. Whereas, yung malignant tumor intensity naman is greater than normal. Don't worry, we will be showing examples in the next slide. And C, calcification. In benign, they are seen to be larger, often smooth yung margin and can easily visualized. Sa malignant tumor, they are usually small and you required to zoom the X-ray para makita mo. So here, let's apply what we learned. So this picture show benign tumor. Here you can see that the margin is smooth, well demarcated, kaya kita mo siya in its entirety. Intensity or opacity is parang clouds, no? See-through or hindi solid white. Shown here are pictures of malignant breast tumors. Check out the margin. Hindi distinct on the left. And on the right, speculated or patusok. Intensity can be said to be greater than normal. Shown to you are terminologies how doctors describe masses. Based on shape, we have the round, the oval, the lobular, which signifies benign tumors, whereas irregular tends to be more on the side of breast cancer. Based on margin naman, naandyan yung circumscribed, no, which tends to be seen with benign tumors. Microlobulated, obscured, indistinct or ill-defined, and speculated favor more on the malignant features or more on the side of breast cancer. Here naman are terminologies how to describe calcification. Based on appearance as to benign, intermediate, and those probably malignant. I don't want to dwell much on this and you can use this as a reference for later. What I feel is important for you to understand is the appearance of probable malignant. The pleomorphic appearance or the heterogeneous seems to have all the benign features all put into one. Dito makikita mo meron kang rod-like calcifications, close to somewhat round, tapos merong malapit na coarse, tapos merong malapit na eggshell. Another characteristic is the fine or linear and or branching calcification. I want you to remember this image for now kasi in the next 2 slides, you will understand bakit ang itsura nito ay tinatawag na malignant feature. Calcifications can be found to be benign or malignant based also on distribution. Diffuse calcification is likely to be benign. Clustered and regional are probably somewhat benign or malignant. But ito pag linear at segmental, they are very likely malignant. I want you to remember this again, these 2 images, kasi makikita mo ang significance yan mamaya. And besides, parang similar ito dun sa nauna kanina na pinatandaan ko, tama? Look into the top leftmost image is a picture of a breast. Pansin mo ba yung small square? Yung small square na yan is enlarged and found on the lower leftmost part of the slide. And that is the basic functional unit of the breast na tinatawag nila ay Terminal Ductal Lobar Unit or TDLU. Now, each TDLU is composed of lobules and acini, which is the one that produces the milk, which drains into the duct para lumabas dun sa mammary. Pero maraming ganyan ang breast. Now, if calcification is found in the lobules, kita mo, yan, picture on the middle, or what you call as lobular calcification, which is described as punctuate or round or milk of calcium, these are benign features. Whereas, if the calcification appears to be pleomorph, or it forms a cast in a linear or branching distribution, then this is said to be highly malignant. Ito yung significance na pinapatandaan ko sa inyo kanina, na kapag ang calcification is fine, linear in or branching, or segmental or linear in distribution, it is very likely malignant. Dito mo maiintindihan bakit nag-branching. Kasi ductal calcification. Ang nakikita mo are signs of ductal calcifications on mammogram. Because you don't see the duct itself. You only see the calcification on mammogram. Ang pag-report ng radiologist based on the mammographic images is based on BI-RADS. This is a standard reporting form for radiologist. This practically has 7 categories, and each category has its own definition. Take, for example, BI-RADS Category 3. The interpretation is probably benign finding and short interval follow-up is suggested. So, babalik ka after 6 months more so to get a repeat. Okay, ito maganda. Can I ask you to describe this? I'll give you 10 seconds. This is not a tumor. This is an extremely dense breast, which makes finding of a tumor hard. Dense, meaning itong breast na to has lots of dense glandular and fibrous tissue. Yung mga radiologists, they classify yung density ng breast base sa 4-level density scale, which is shown to you. Category A, as shown on the left, is a breast that is almost entirely made out of fat. So kung meron kang cancer dyan or calcification, you can see it right away. On the far right, category D, is extremely dense. Yan yung example kanina. And it is very hard to see the mass or other findings. A comparison of the two is shown to you on the slide. The left shows a fatty breast or category A, where a cancer can easily be detected. Whereas, in a dense breast on the right, the cancer is harder to detect because parehong dense yung tissue at yung cancer na nakabilog, and both appears white on mammogram. So why is breast density important ba? Well, two things. Women who have dense breast have a higher risk of breast cancer. And secondly, mahirap makita ang cancer if you have a dense breast. So kapag ganito ang breast mo, dense, paano na? Anong gagawin? And how can we detect the cancer? Shown to you here are options you can do to evaluate dense breast. Para maintindihan nalo, iisa-isahin natin ito for you to understand. What is important is the principle ng bawat isa. So, handa na? One modality to assess dense breast is digital breast tomosynthesis or DBT, otherwise known as 3D mammography. It's actually an upgrade of a 2D to 3D by taking more photos of the breast at different angles and reconstructing a breast view in 3 dimensions. To know more about this, let's watch this video.
There's a new tool in the fight against breast cancer. It's called tomosynthesis. Tomosynthesis is basically a 3D mammogram. The 3D exam looks and feels like a regular mammogram, only it takes a few seconds longer for each view. That's because the X-ray arm swings over your breast, gathering enough extra information to create a three-dimensional image set. So now the doctors can see and search through your tissue in 1 millimeter layers. Why is this a good thing? Well, a traditional 2D mammogram shows all the breast tissue at a glance. That means one feature can hide in the shadow of another. So it might look like there's cancer where there isn't any, or there could be a tiny cancer we just can't see. 3D tomosynthesis is different because it shows your tissue in very thin layers, almost like turning pages in a book. That makes it easier for doctors to see if there's anything to be concerned about. There's less chance for a cancer to hide behind overlapping tissue. It also means there's less chance your doctor will call you back later for a second look, because they can see more clearly now. And yet, for all the extra clarity it brings, your X-ray exposure is only about the same as a traditional mammogram done on film. That's well within the safety limits set by the health authorities. We can't prevent breast cancer, but if we find it early enough, we can stop it before it stops you. Tomosynthesis is one more tool to make early detection even earlier.
Another modality to evaluate a dense breast is another type of mammography known as contrast-enhanced spectral mammography. Dito, the patient will need contrast given through intravenous route or IV route. Then, pagtapos, imamammography yung pasyente using 3D mammography. The contrast will highlight the mass on mammography para madaling makita. And if you have a dense breast, they have this technology that subtracts from the image yung dense breast para ang makikita yung nag-highlight lang na bukol. Let's watch this.
Welcome to 2013 RSNA. Tonight we are in the women's healthcare area, and I want to talk to you about a new technology that we brought to market called Cenobrite. Cenobrite is contrast-enhanced spectral mammography that is given as a diagnostic tool to physicians to help with the diagnosis of breast cancer. It's used when it's an inconclusive mammogram and an ultrasound, and they're looking for another tool to diagnose the patient quickly to reduce the anxiety of the patient and find results faster. So how it works is it's done in the same day, in the same room as a screening mammogram, and it takes about 10 minutes. We actually inject intravenous contrast into the vein, wait about 5 minutes, and take some more images that are high energy and low energy images. They are then merged together, and the breast tissue is subtracted out, which enables you to see the lesion that would be highlighted with the contrast. If you want to learn more about Cenobrite, please contact your local GE representative or go to cenobrite.com for more information. Thank you.
Breast ultrasound is complementary to breast. This is why, madalas rito sa atin, kapag mayroong request ng mammogram, normally may kasama parating ultrasound. Shown to you on the slide, mammography images that complements that of the ultrasound images. This slide differentiates the ultrasonologic findings between a cyst, a fibroadenoma, which is practically a benign tumor, cancer or malignancy or malignant tumor, and that of a normal glandular tissue, like in the case of a dense breast. Try to note the different ultrasound distinguishing features based on shape, margin, orientation, enhancement, and calcification. There is also now a three-dimensional automated breast ultrasound system. Let's watch this video kasi this video is self-explanatory of its advantages.
Invenia ABUS Automated Breast Ultrasound System is a comfortable supplemental screening option for women with dense breast tissue. When used in addition to mammography, Invenia ABUS can improve breast cancer detection in women with dense breasts than mammography alone. Invenia ABUS architecture makes the overall workflow go quickly. 3 angles of each breast are scanned, capturing whole breast 3D volumes in about 15 minutes. Invenia ABUS uses a 15-centimeter high-frequency reverse curve transducer with a field of view that is at least 3 times larger than a traditional ultrasound transducer. Combine that with the massive processing power of the Invenia ABUS engine, and you have an impressive system that produces 3 million pixels per second. With single-button activation, the reverse curve transducer automatically scans across the breast in approximately 30 seconds. The shape of the reverse curve transducer comfortably fits the natural curvature of the breast and improves ultrasound penetration near the breast's edges. Traditional handheld ultrasound is operator-dependent with long acquisition times and is limited to areas of focus known as focal zones. Areas outside the focal zone have decreased resolution. Increasing focal zones may increase resolution, but decreases frame rate. Invenia ABUS's steered wide beam technology creates a focused pixel at every point within the image, resulting in a high-resolution image from skin line to chest wall, up to 5 centimeters deep. Invenia ABUS does not depend on focal zones. The reverse curve transducer fires multiple wide beams for each frame with various transmit angles for each wave. This creates a focused pixel at every point within the image. Invenia ABUS reconstructs 3 million pixels a second at high frame rates to compute a full 3D breast volume from one single scan. Processing more data than traditional ultrasound systems enables Invenia ABUS breast volumes to be greater than 3 times larger than traditional handheld ultrasound volumes. Fully focused 3D renderings and reconstruction of the coronal planes are computed in real time using coherent compounding GPU software, allowing physicians to review the entire breast volume in 3 planes: coronal, axial, and sagittal. Invenia ABUS, helping physicians look differently at dense breasts.
Another modality that we can use for a dense breast is breast MRI. Now, alam natin MRI are mahal. So MRI is not for everyone. To understand the subsets of patients who will benefit from breast MRI, let's watch this video.
Well, breast MRI is another tool that we have to evaluate patients primarily for breast cancer. And not everyone needs one, and not everyone will ever have to have one. It's a really nice test because it's very sensitive for detecting breast cancer, especially invasive breast cancer. And so we'll order it or recommend it in patients. There's a group of patients that are at high risk for developing breast cancer, and those patients, the American Cancer Society has actually recommended that they get screening with breast MRI, and they've said patients with a 20 to 25% risk of developing breast cancer. So that would be something you'd want to discuss with your referring physician or family physician. Am I at that high risk? Then we just recommend it as a screening tool. Otherwise, we'll use it in patients that maybe have a lump or a problem, but we don't see anything on their mammogram or ultrasound. We always start, when we're working up a breast problem, we always start with mammogram, and then especially if the person's over age 30, and then frequently they'll have an ultrasound. But after we do the standard sort of workup, if we're still wondering what's going on, there still seems like there's something we feel, but we don't really see it, we might recommend an MRI in that situation. Women that have been diagnosed with breast cancer are one of the more common people that would get an MRI, because it can be very helpful for pre-surgical planning. Occasionally, because the MRI is very sensitive, sometimes they can find additional areas of cancer that need to be addressed, either in the same breast or in the opposite breast. It might give the surgeon a better idea of the extent of the breast cancer, so they can plan their surgery better, might be able to tell whether their lymph nodes look like they're abnormal. So there's a lot of information that the surgeon can get from the breast MRI to help them tailor the surgery for that particular patient. So again, it's not done for every patient. It's almost too sensitive. It picks up things that aren't cancer, so we really wouldn't want everyone to get an MRI. A lot of people will be getting unnecessary evaluations. It's also a fairly expensive test. It's not always covered by insurance. Some people are claustrophobic, so you're in a tunnel sort of thing to get the MRI, so some patients might not be able to get one because of claustrophobia. They've had all the other things for MRIs that you have to be screened for, like pacemakers or metal in the orbits and things like that. So it's a great test, but it's a very specific sort of test. So again, not everyone would need to get one, and it's something that the radiologist can usually let the patient know whether it's something they would advise, or their referring physician.
Shown to you are the approved US indications for the use of a breast MRI. As a screening tool, if you are at high risk for breast cancer, no, yung strong family history or genetic markers for breast cancer, then breast MRI is indicated. And if you have a very dense breast, of course, there are other reasons. If you wanted to check for more cancer in the same breast or the other breast after breast cancer has been diagnosed. If you also would want to distinguish between a scar tissue and a tumor in the breast. Also, if you want to evaluate further an abnormal result from a mammogram or a breast ultrasound. Occasionally, for the evaluation of a possible rupture from a breast implant. Likewise, it addresses finding of cancer remains after surgery or chemotherapy. It also shows blood flow through the breast area. And finally, as a guide to a MRI based biopsy.